Hey guys, Dr. Ian Rassel here at Corrective Spinal Care of California. We're really excited to share with you some information today about lower back pain. You know, so many people are suffering from lower back pain. You know, I've been here 20 years, the clinic's been here for 45 years, and the two most common problems we see, neck pain, and then definitely number one is going to be lower back pain. And so often we have patients who've been here for 40 years that are not suffering. You know, patients that are in their 70s, 80s, and even 90s, that the back pain was a thing of the past. Yet there's guys and gals 20, 30, 40, 50 years of age that it happens 3-4 times a year, and it happens more and more frequent, and eventually it gets more and more intense. So let's go over what we can be doing to get to the bottom of the lower back problem. So first and foremost, you gotta be thinking about the lower back in terms of the mechanics of it, right? So when we look at the back from the side, it has a nice gentle curve. There's these shock absorbers, these discs in between the bones that help cushion the spine, right? Anytime these bones get out of their normal position, we call it a subluxation. And depending on where that subluxation is, the nerve is going to affect a different area. So you've heard of sciatica before? Well, these are the nerves in the bottom of the lower back, the bottom of the lumbar spine, that come together to form one of the biggest nerves in the body called the sciatic nerve. Those of you that have had sciatica can have that searing sensation down the leg. That's coming from these nerves being severely pinched. Now, not all the time are people going to experience sciatica when they have a pinched nerve. In a different video, we're going to go over the difference between if this is a sciatic problem, is this a disc problem, is this a muscular problem. But I want to get to the basis of lower back pain first. So how do we get lower back pain to begin with? Now I got to tell you, I've injured my back over a dozen times in my life. The most recent one, there was a compression fracture at L1. And so now, if I'm stressed, if I'm dehydrated, not got enough sleep, my immune system's low, there's going to be some aching down there. And many of you have experienced that area, maybe even your upper back or neck. Now, what we can do to prevent this from getting worse is, first off, we've got to figure out what sort of mechanical problem you have. So what we'll do is, as a new patient in our clinic, we're going to do some specific testing to see how well is that area working, how well is it moving, how well is it bending, how well is it going into extension. We'll then get some special pictures, what we call digital x-rays from the front and then digital x-rays from the side. And then we can determine whether or not your problem is a chiropractic problem. Now, if this is a pinched nerve, we can help. If this is a disc problem, we can help. And we want to differentiate the difference between them. So we oftentimes lead to our stressors, right? What's going on at home, at work, our life, taxes, running a business, running a family. All these stressors can have an impact on that lower back. So those are our mental and emotional stressors. What about chemical stressors? What about eating tons of refined junk food, or even health food that you think is healthy that's chock full of chemicals and rancid seed oils? They all can cause your spine to be more likely to get injured. Okay. I mentioned dehydration, mental stress, and then of course we're going to blame the mechanical stress, right? I was at my mother-in-law's barbecue and I was getting a plate of tacos and my back went out. So we got to look towards our postures of our day-to-day lives. So many patients, particularly men, we're always lifting with our spines. We need to learn to lift with our legs and our hips using better mechanics. So if your problem is coming from a postural issue, we need to correct the posture, we need to change the mechanics, and we definitely need to change some of the postures at home. How often do we see people with back pain from lifting, but the cause is they're sitting in a chair. You know, you're sitting, you're driving. Now, I've noticed that the newer the car, the more my feet go out like a duck. And when that happens, that puts a lot of pressure on that lower back and the hips. So let's make sure when we're driving, our feet are pointed forward, okay? And if we're driving for any lengthy periods of time, you'll notice that when I'm driving, my legs are up here, this muscle's contracted and shortened, that hip flexor. So if we're sitting in the car, we're sitting behind a computer, we're hunched over for hours at a time, then we get up and we go rotate and twist. That can easily cause further injury. So we need to make sure when we're lifting, when we're sitting, that we have the right balance in the muscle tone. Very often we have a weakened core because we're sitting so much, we're not active, we're not 5,000 years ago bringing an elk or digging roots all day to feed the family. We're sitting in chairs, and when we sit, we lose the proper balance and muscle tone. We get a weaker core, we get tight hip flexors, we get tight lower back muscles. So we want to help strengthen the glutes, the hamstrings, lower abdominals so that everything's in balance. Goodness, I think of all the patients over the years who they come in, they get examined, they get x-rayed, we develop a course and a treatment specifically for them, and after 3, 4, 5 visits, they're feeling a whole lot better and they stop care because the pain went away. They're feeling better. And I'm here to share with you, unless you get to the root of the problem and correct the problem, it will continue. And unfortunately, when that patient comes in 2 years later, 5 years later, to start the protocol again, oftentimes they've gotten more and more degeneration. And now you can see, rather than beautiful healthy discs, the bones are starting to rub together. We're getting rough edges, degeneration, and arthritis. We also see that those big, thick cushions between the bones, they start to wear out as well. Degenerative disc disease, bulging and herniated discs. Rather than continue to wait for this problem to get worse, it makes the most sense to correct it as soon as possible. So following through with our recipe that's specifically for you, you're going to get the best out of our care. The beginning phase of care, initial intensive care, the whole focus, we want to calm down inflammation. We want to get you moving better so you can get back to your routines, your workouts, your lifestyle, your work. So those first 1 to 3 weeks, our goal is to calm down the inflammation. And we do that with specific chiropractic adjustments. We have the patients going for gentle walks and stretching and lengthening muscles, utilizing ice and heat accordingly. If you're needing over-the-counter anti-inflammatories, utilizing those. If your doctors put you on a prescription anti-inflammatory, continuing to use those. As the inflammation calms down, we get into the second phase of care. This is that corrective phase, that strengthening and remodeling. And depending on how long the problem's been there, this remodeling phase could be months, could be a year or 2, depending on how long the problem's been there. And in this phase of care, we're focusing on the corrective chiropractic adjustments. We're now focusing on strengthening areas that need to be strengthened while continuing to lengthen the muscles that need to be lengthened. Now, during this phase of care, our doctors are going to give you a specific plan and a course of action tailored to your needs. Now, I've noticed over the years, the patients that stick to exactly our recipe, they get the best results. It reminds me, my mom makes this amazing flourless chocolate cake. And those of you that know about flourless chocolate cake know that it's basically just sugar. So if we gave you that recipe of flourless chocolate cake and you said, you know what, I'm gonna make this healthier. I'm gonna take out the sugar. I'm gonna put in maple syrup instead. There's a pretty good chance that that's gonna taste awful. It's not gonna be nearly as good as the original recipe. And I see the same here in our clinic, that if you can follow through with the care that doctors prescribe to you and follow that recipe to the T, you're gonna get the best outcome. Now you gotta remember, your body, your muscles, they have a memory, there's patterns. So if someone's been sitting for 10, 20 years, if there was an old baseball injury in Little League and now we fast forward 25 years and your body has a pattern, when we're done correcting you, your body's gonna want to go back to that old pattern. Much like, when you're losing weight, you go on a diet, you change your life. You start eating whole foods, you start exercising, you shed the pounds. The last thing you should do is, once you've reached your goal, is go back to eating donuts and sodas, because it's gonna go right back to where it was. Or working out. You're working out every day, 5 days a week, and you gain all this muscle mass and all this growth. The last thing you're gonna do is go back to sitting on the couch. It just doesn't make sense. So when patients are done with the beginning phase of care, the initial intensive care, they go to the secondary care, remodeling, corrective, and strengthening. And once we've gotten you as good as we can, we re-x-ray so we can compare the first x-ray to the newest. And if we did our job right and the patient, you did your job right, those x-rays will show us either corrected and fixed or patched and stable. And from there we can talk about a course of maintenance care so you never have to go back to where you were. This formula I'm sharing with you is one that has been proven and is utilizing the most science available to get people well to avoid needles, knives, and surgery. Now, some of my best friends are surgeons and orthopedic surgeons, and they'll tell you the exact same thing. Spinal surgery is one of the worst things you can do to correct a problem because you're going to have continued problems in that area. So we want to avoid drugs, needles, surgery at all costs. But to do so, it's going to be work. And if you're willing to put in the time and the effort to correct this problem, I'm confident the doctors here at Corrective Spinal Care can be of life-changing significance to you and your family. If you like this video, if it made sense to you, you can subscribe, you can like, you can write in the comments, share it with a friend. If you know someone that needs to hear this information, please share it. And give us a call at Corrective Spinal Care of California.